Welcome to Deans Discuss, a podcast that examines how science and research at UC Davis affect our everyday lives. Join our hosts, Allison Brashear, Dean of the UC Davis School of Medicine, and Michael Larimore, Dean of the UC Davis School of Veterinary Medicine, as they give their thoughts on how the work of scientists, physicians, and researchers affects us all.
Hi, Allison. One of the things that's really been fascinating about this whole COVID crisis that we've all endured and the nation and the world has endured is how leaders are forged during a crisis. It's a subject I know is really important to you. And I ran across an interesting example of that actually related to coronavirus. Did you know that it was a woman in 1966 that was looking at a problem of trying to figure out a virus and how to look at them under what was called a brand new instrument back then, about an electron microscope. And she solved it by being a leader, and she took it upon herself to use a new technique to stick the viruses together. And her name was June Alameda. And in 1966, she was the first one to visualize coronaviruses and name them for their shape under that electron micrograph. So a leader that was born out in a crisis. And I know you have probably a lot of examples of that in the School of Medicine.
Well, yes, we do. We have many leaders in the School of Medicine who jumped in. I like to frame it around a couple of things. One, empathy for the issue that's at hand. And in this crisis, it's empathy for the patients, the family, the workers. And then a leader really bringing people together and bringing all the talents that are in the organization so that they can just thrive. And so I think that puts a positive framework on a crisis rather than woe is me type of thing. And I think that's what's happened in academic medicine and in veterinary medicine. People have jumped in and they're incredibly empathetic for the situation that everybody's in, but also providing just incredible opportunities. Did we ever imagine that we would flip 30 to 50% of our visits to telemedicine? Or in a million years, can you ever think of a clinical trial be up and running in 5 days? So I think that it's given people opportunities to just jump in and do that. But it is, leadership is really about bringing people together.
Yeah, the other thing is that we've had to move fast because, this was thrust upon us in a very short period of time. And the speed at which we had to do that as leaders, but also across the whole campus. We have many examples in our faculty of leaders that responded. Some of our faculty, for example, who had expertise, with COVID, such as John Mazette in the PREDICT program in our One Health Institute, which you had on in your town hall.
Our town hall, she did a great job.
And I think that that's a great example. She was already a leader, but she jumped in very quickly to help. And then her and Chris Coiter Johnson and Valtrina Smith, all three of those leaders worked together to form 3 different federal grants that covered everything from the detection of the virus to developing a workforce. And they did that in part because they were prepared. And part of leadership is, of course, in a crisis is to be prepared, but then move quickly when the opportunity came up. And certainly there are great examples of that.
Well, being prepared is kind of the foundational part of leadership. And I think that's one of the things that's put UC Davis in a good spot here. We had people like you just mentioned, but also in terms of public health, we were really prepared. So Brad Pollock helped lead the campus to this high throughput screening opportunity, but it's really more than just testing. It's really about putting a whole program together for healthy UC Davis. So I think that one of the things about leadership is really getting people to bring their best selves to work and providing a framework. I like to see myself as a convener and a translator. And then I also love to move barriers out of the way. So, that's one of the things with all these trials is moving barriers out of the way and just making it so people can do what they're passionate about. And that's about bringing research to patients, getting people to be healthier. Those are the things that really make everybody tick. And, that's why this is a great place to work.
You brought up a really interesting point too, which is sometimes when you have to move quickly, you have to also adapt quickly. And one of our campus sayings that our chancellor likes to use is boldly go. Well, you have to adapt boldly in this crisis, and all of us had to adapt in a very quick fashion. One of the heroes I think is unsung heroes is how our faculty adapted in both our schools very quickly to the curriculum. And we talked about that earlier in the podcast, but also the number of people that were heroes that were probably not as evident, and that includes students. Students, for example, that stepped up to get involved in their community, both
Right.
at the medical students and veterinary students who, they're very community and active, and many of those came forward, acted boldly to help. Could be helping fellow students. It could be other ways that they helped. I know you had a couple of examples of that
We
specific.
did. We had students who went out and helped the homeless, educated them about the virus, helped them with screening. And, one of these other things the chancellor says all the time is it's what we do.
Yeah.
And so that's kind of the foundation of the core principles of community of UC Davis. And that's, really acting in crises on following up on your core values. And that's where you go out and we are screening the underserved, bringing testing to them, making sure that they're safe, just like you were making sure the animals are safe. And the same thing happened with the fires, making sure people are safe, bringing care to them. You brought care to the animals, very importantly.
Yeah.
So I think, one of the things that I really like to see is I love seeing young people just blossom as leaders. And that's one of the things I really have enjoyed about being a dean and enjoyed in the past about being a chair, seeing people take a problem, run with it, come up with solutions, bring a group together. I think it's just really so heartwarming when that happens, because that we're in a good situation for the future. We've got a great legacy here to carry on really making people healthy.
Yeah, we had a great example. We have many examples of that related to the fires here in California. We have a veterinary emergency response team. And last year, one of our students who graduated last year, Haley Dykeman, who developed a real interest in this area and became a real leader. She helped organize, got everybody together. She would send out reports. We'd get these daily reports of what teams were going where with the ambulatory trucks to help the animals. And then she turned that around, and this is another sign of leadership. She documented that recently and actually published the findings from that in the Journal of the American Veterinary Medical Association. So that was really cool to see a student not only develop leadership skills in a crisis, but turn that around to document that so that it really taught the next group of students on how to respond in a crisis. Another good form of leadership is, building something and then also helping others become involved. And then after you're gone, it will continue. And that's what Haley did with this project. And we see it today as well with the current fires and the current rescue efforts.
So I think the takeaway really for professionals is, we teach a lot of science in school, but we don't necessarily teach about leadership. And I think that's one of the things we as leaders need to think about is, what does it mean to lead a team and also be a member of a team? And what do you do when there's a crisis? And I think one of the things is to have really good communication and constant, clear communication. So everybody knows what's what, because the information is changing. It's still changing now. I mean, the CDC has just recently changed things. So clear communication, constant feedback on what's going on, and also making sure that you're engaging a broad constituent so that they can then give the information out. I think those are the key pieces, because that's what's worked best, I think, across the country. We're about, 9 months into this now, and it's clear that the places that have done well really were constantly communicating, and kind of everybody was bringing their best self to work and coming up with ideas. And I think that's what's been so rewarding here, to really see how everybody's jumped in. But you know what? Now it's going to be continuous, right? Crisis management's kind of the adrenaline's going and stuff, and now we don't have so much adrenaline anymore. And so I think that's going to be another stage.
It's for the long haul, and to be able to manage that. One of the things that it really takes is a team. We formed a crisis management team, which we meet. But it includes everybody from physical facilities to those that are doing the testing, to those that are delivering the curriculum. And when we get the team together, one thing that really involves is exchanging ideas, listening to everybody at the table and asking, what is it that we need to do, and then adapting quickly to that. So our crisis management team, I know you have those in the School of Medicine.
Yeah.
Those are really critical to really listen to everybody at the table. And then, because it could be the crisis today is a air ventilation unit going out. The crisis tomorrow is some unexpected breakdown in a laboratory. It changes. And with this, I think we need to really adapt, but also rely upon teams. And that won't go away. That lessons that we're learning from this COVID pandemic is something that really is going to help us going forward.
Yeah, I think so. Well, this has been a great discussion. I think it's really a focus on building the team, communication, empathy for the people in the crisis. It's amazing. Every time I go home and I'm driving, and I'm reminded about how dense this pandemic is and how many lives have been lost and touched. The world will never be the same, as we and leaders have to really kind of understand that and help our teams get to a point where we can really make a difference. And it's changed medicine, and I'm sure it's changed veterinary medicine forever. Things will never be the same. I can't imagine that the teaching's going to ever be the same, to be quite honest.
And when we walk through our hospitals and we look into the eyes of those in our emergency rooms, and we see their examples, we see their dedication, working long hours on the front lines, those are the real leaders in this crisis. It's not those in suits, it's really those on the front lines. It's those that are coming to work every day and helping on the front lines, whether it be in the field in a fire or in our emergency rooms. And that's been really, really impressive. So my hats off go to those leaders who are often unsung heroes in this story.
Everybody's a leader in their own area, in their own right. And, that's something we just have to celebrate, because that's what's getting us through. And I couldn't have said it better. It's just been really so impressive to see how everybody has done that.
And thank you so much, Allison. It's been a great discussion. I look forward to our next subject, which is about herd immunity.
Herd immunity, that's
a topic we've heard a lot about, originating from animals, but now applied to the current COVID pandemic. So that'll be an interesting discussion. Look forward to that one.
Sounds great.
Like what you heard or have an idea for a future episode? Email the deans with your suggestions at deansdiscuss@ucdavis.edu. And don't forget to subscribe so you don't miss an episode. Deans Discuss Podcast is available free on demand at Apple Podcasts, Google Podcasts, Amazon's TuneIn, Stitcher, Pandora, and Spotify. This is Deans Discuss.